Documentation and record keeping are integral aspects of being a successful healthcare professional. Proper documentation ensures that patients receive accurate diagnoses, effective treatments, and appropriate follow-up care. Records serve as valuable tools for communication between healthcare providers, tracking patient progress, monitoring trends in treatment outcomes, improving quality of care, defending against malpractice claims, and facilitating insurance reimbursement. Here are some best practices for documentation and record keeping for healthcare professionals. Maintain thorough medical records. Start each encounter by documenting basic information such as date, time, location, chief complaint, history of present illness, physical examination findings, laboratory results, diagnostic studies, medications prescribed, discontinued, allergies and prior surgeries or procedures. Use standardized forms whenever possible for consistency and completeness. Make copies available for review upon request. Write legible notes. Always write clearly and legibly so that others can easily read and understand your documentation. Avoid abbreviations if they aren't commonly used within your organization. Instead, provide full explanations unless instructed otherwise. Use bullet points where appropriate to organize thoughts and make your note easier to scan quickly. Be concise and specific. Keep your documentation focused on relevant information without unnecessary details. Identify key issues rather than describing everything about every symptom or test result. Summarize complex concepts or lengthy conversations when sharing information with colleagues. Remember, documentation serves multiple purposes beyond recording information gathered during examinations. It helps guide treatment decisions, educate patients, and inform insurance companies regarding medical necessity. Utilize templates and checklists. Create standard templates and checklists for common scenarios like medication administration, discharge summaries, patient education materials, etc. This will ensure consistency across your practice and reduce errors due to forgetfulness or negligence. Templates help maintain accuracy and save time by reducing redundancy. Implement electronic health record systems, EHR. Invest in EHR software if applicable, and train staff members how to effectively utilize these systems. Electronic documentation improves efficiency by eliminating manual entry of data, reduces clerical errors, allows instantaneous access to up-to-date records, enhances collaboration among healthcare teams, enables remote consultation, supports regulatory compliance, streamlines billing processes, and offers enhanced reporting capabilities. Many EHR platforms integrate seamlessly with mobile devices, allowing healthcare professionals to update records remotely anytime, anywhere. Encourage proper documentation habits. Train new employees on best practices for documentation and record keeping early in their tenure. Continually reinforce these principles throughout their career development. Conduct regular audits and feedback sessions to monitor compliance and address deficiencies promptly. Empower physicians and nurses to take ownership of their documentation through training programs, workshops, mentoring, and coaching. Establish protocols for retention and disposal of records. Define guidelines for maintaining medical records based on regulations imposed by state and federal agencies responsible for protecting patient privacy and confidentiality. Develop plans for securely storing paper documents, backing up digital files regularly, archiving older records electronically, and destroying records no longer needed. Ensure all departments adhere to these policies consistently. Regularly review and update records. Periodically revisit completed records to verify their accuracy and currency. Update information as necessary to reflect changes in patient condition, diagnosis, treatment plan, medications prescribed, or insurance coverage. Review charts frequently to identify patterns or trends that might indicate areas requiring improvement in patient care services. Protect patient privacy and confidentiality. Handle sensitive patient information carefully following established protocols designed to safeguard patient privacy rights. Restrict unauthorized access to protected health information, PHI. Encrypt PHI stored electronically, implement authentication measures, and train personnel involved in handling PHI appropriately. Perform periodic security assessments and comply with HIPAA requirements to minimize risks associated with breaches and violations. 10. Engage in ongoing reflection and continuous learning. Documentation and record keeping involve more than just checking boxes. Healthcare professionals must continuously evaluate their practice, engage in self-reflection, assess effectiveness in providing care, seek